Hello everyone, this is Dr. Bob DeMaria, and in this session I would like to talk to you about the labs that we use in our practice to help our individual patients with mental health. Let's start off with the OptiChem profile. The OptiChem profile has a portion of it called the Comprehensive Metabolic Panel, and in that panel we are looking for alkaline phosphatase. Alkaline phosphatase happens to be an enzyme that's impacted by zinc. And if your alkaline phosphatase is low, as you learned from me from other sessions, you may have a deficiency in zinc, and zinc is important for memory. We're also looking at your uric acid level in the OptiChem profile, and the uric acid level, if it is low, you're going to possibly have a deficiency of B12. And what you should have learned from me is the fact that vitamin B12 is important for your nervous system. It's very important for your body, so you're not going to have Alzheimer's and dementia. And we know that certain drugs will take B12 out of the body. Those are digestive drugs. We'll look at the globulin level also on that OptiChem profile. That's telling me how your digestion is doing. So those are basics. There's many more in the OptiChem profile. Probably one of the more important tests that we look at is the omega test. The omega test, we're looking at the levels of DHA and DPA. Those are the oils for your brain. Those are omega-3 oils. On the other hand, we're looking at the omega-6 oils. Those oils tend to cause inflammation, especially if you're consuming a lot of them, and that would include safflower oil and sunflower oil. You want to back off on those oils, and we can determine those amounts inside of your body. There's another test called the H, that's heart CRP, C-reactive protein. We're looking for sensitivity there, and it's going to tell, it's very sensitive, and I know that if your CRP is elevated, chances are you have inflammation in your body. We also look at homocysteine. I know if homocysteine is elevated, we have potential for inflammation, usually a B vitamin need when you have an excessive amount of homocysteine. A very important test to us is the organics urine test. We have learned so much from the organics urine test, but one of the big markers I've learned from that is a byproduct of metabolism of adrenal hormones called adrenaline, noradrenaline, or epinephrine. Those hormones are made from something called tyrosine. And if you have a tyrosine deficiency, you have a greater chance to have depression because tyrosine is a natural antidepressant. We also look at the thyroid hormone levels. We look at TSH, T3, and T4 because we know that if those are not normal, the chances are you can have a low thyroid, but the thyroid is also impacted by tyrosine and iodine working together. And if you don't have enough tyrosine, you have a greater chance to have depression. And we have conversation with our patients to see what's going on. We can always customize any type of lab test that we need to do to help improve your mental health.